Sierra Leone had faced an existential threat was 1999-2000, and Britain sent hundreds, times thousands of soldiers. This threat to the people of Sierra Leone seems to be, if anything, even bigger, and Britain is only sending a few dozen soldiers. Why is that?
Well, it's a different kind of threat, obviously. The threat this time is from a terrible virus. What is needed is, of course, logistics support, and the military are providing us with a logistics hub. We need to respond to this crisis by dispatching skilled health workers and building safe facilities in which they can isolate and treat people who have the virus. It's not something that is susceptible of the kind of response that was made back in 1999-2000. But the military is, as the Development Secretary has just said, playing a significant role, both in terms of providing medical staffing and in terms of overseeing construction of the new beds. Most of it will be done by local contractors, but under the oversight of Royal Engineers, and running the logistics operation, which will keep our operations in Sierra Leone linked with our logistics hubs back here in a situation where transport has become quite difficult. If we need more military support, we'll ask for it, and I'm sure the military will do their very best to provide whatever we need, but we think we've got the balance about right at the moment. And what we really urgently need now is more qualified international medical and nursing staff. And the military has limited capacity to supply those without simply drawing reservists out of the NHS, which is not the route we prefer to go. We prefer to work with volunteers. Many NHS staff have volunteered already.
Thank you. Harriet Alexander from The Telegraph. Foreign Secretary, you said that the conference today you have increased the odds of success in the battle against Ebola. So I want to know, what is your response to calls this morning from the International Development Committee, who said that in reducing the aid budget to Sierra Leone and Liberia by up to a fifth, you've actually already undermined this?
I think they're probably mistaken.
Perhaps if I can, yes, I mean, if I can just set out, the UK is the largest bilateral donor to Sierra Leone. In fact, over the last few years, our aid programme has grown in size rather than reduced, and I think you can see further support that we're providing to Sierra Leone in terms of this £125 million package today. So I think there's no question of our support to Sierra Leone being something that is not only forward-based and ongoing, but when crisis hits, we're prepared to scale it up significantly.
Jonathan Miller from Channel 4 News. Secretary, I'd like to just pursue the last question again. President Obama has said that this epidemic has spread in the way that it has because of the dilapidated state of the health infrastructure in these countries, Sierra Leone included. Do you think now that, given that 18.6% reduction in British aid, that it might have been short-sighted given the fact that this did include the health sector?
I don't think those numbers are right. Actually, in 2010, the UK's bilateral programme was 51 million. In 2013-14, it was actually 68 million. That fails to, of course, include spend that the UK helps fund through things like the Global Fund, which tackles AIDS, TB and malaria. We estimate that put around $31 million directed to Sierra Leone, for example, this year. It misses payments through Gavi, which does vaccination work. So, first of all, our bilateral programme has grown in size, and secondly, as this government's met its 0.7% commitment, we've been able to increase our support for the many global mechanisms by which healthcare is tackled. So I don't think that's correct. But this point around why it's important for countries like Sierra Leone, like Nigeria, like Liberia to have their health systems strengthened is absolutely right. We see that today, and that's why I think as a government we've been right to strong with me on this 0.7% commitment, because I think we see in the case of Ebola how short-sighted it would be to fail to help these countries develop those systems.
So just to clarify, there was no cut?
I think I've just I've set out very, very clearly that we've actually increased our bilateral programme. I've also set out that through our overall broader increase to international development spend over the last 4 years, we've also increased our commitment to global mechanisms like the Global Fund, like Gavi, as well, which also directly support Sierra Leone.
The President of Liberia, Ellen Johnson Sirleaf, said yesterday that the Ebola situation in her country was stabilising, that the worst predictions were exaggerations. Yet we have Save the Children, for example, this morning saying that I know Sierra Leone is a different country, but it's the neighbour, and it has many of the same problems, saying that in Sierra Leone we're talking about 5 cases an hour, going on to 10 cases an hour by the end of the month. I know we don't like mixed messages at a time like this, but how do you see the situation in Sierra Leone, and how do you explain this discrepancy in predictions about where we're going?
It's very easy for me to comment on Sierra Leone, where we're working hand in hand with the government to tackle Ebola. But there's no doubt that getting a true sense of the extent of the disease has been challenging. It was only recently when we saw the CDC come out with revised figures around the fact that it believes by January next year, if we do nothing, around 1.4, 1.5 million people could become infected. And one of the biggest problems that we've had in making sure we scale up our response to the right level is understanding how many people are infected, particularly in very, very rural communities where families and people may be unwilling to come forward to get medical treatment for various reasons. It's always not easy to get a sense of the true levels. What we do know is that if we fail to take action to tackle Ebola, if we allow this disease, which has already proved itself fatal for so many people, to spread unchecked, then it will be far harder to tackle it in the future than if we start and get on with the steps that we've already announced that we're now getting international support for, and get on with those right now. And that's what today this conference was all about. It's still underway. We've got a range of support from a range of different countries, and we now need to build on that, keep that momentum going, and allow us to scale up our work, particularly in Sierra Leone over the coming weeks and months. But we should be also clear that this disease and the numbers of people infected will get worse before it gets better. This is about bearing down on the rate of transmission that we're currently seeing, so that we can bring that down, get it under control, and then beyond that, start to actually eradicate Ebola more completely.
I think just a word on mixed messages. Of course, you're absolutely right, and different people will have different perceptions and various different messages that they need to deliver for various different reasons. I think it's important that we focus on a single set of data from reputable international epidemiologists to guide us in this. We don't allow ourselves to be sidetracked or deflected. We have to focus on the scientific data. We have to respond to the science. Thank you. Thank you very much.